We've talked about the importance of early intervention and detailed the warning signs that could indicate substance abuse. So, how should you respond if you suspect a problem? In this video, we'll discuss the actions that school staff can and can't take if they suspect youth substance use. You'll learn how to utilize a student assistance program team, the role of privacy laws and regulations, and how to connect with youth and their parents or caregivers. School staff will be able to respond more effectively to concerns about individual students if all students are familiar with the basics about getting professional help for mental health or substance use disorders. Staff can discuss ways to access support in classes, post information in visible places in the school, and provide this same information to parents. This first step will help to establish an atmosphere of acceptance and support rather than shame and judgment for these common problems. The Pennsylvania Department of Drug and Alcohol Programs website offers a number of excellent resources to help people of all ages get the assistance they may need. When school staff become aware of a youth who may be abusing substances, the first step is to reach out to the school's student assistance program, counselors, or student services personnel to share the concern. These professionals can provide guidance and support for next steps. When staff reach out for support, they should be prepared to explain what behaviors they have observed and what information the youth, their peers, or parents have shared. It is important to respect the privacy rights of students and families and be aware of what information can be shared and with whom. Pupil Services staff can provide guidance on school policy regarding privacy laws and other related regulations. It is important to maintain connections with youth who may be using substances, even if you are not able to discuss your concerns with them directly. Continued participation in classes and activities can be important protective factors for these vulnerable young people. In situations where staff are able to discuss the substance use with the student, here are a few guidelines they can follow. 1, simply ask what you can do to help. And then 2, listen. 3, don't make assumptions based on your own experiences. And 4, avoid moralistic, judging, or shaming statements. 5, be willing to set realistic expectations for learning and schoolwork to maintain engagement with academic goals. And finally, 6, let the youth know that you will always seek help from counselors and caregivers for any student you're worried about. Establishing and maintaining connections between parents and the school can also be an important protective factor. Again, staff will need to proceed with caution in talking to parents or caregivers and seek guidance from student assistance program teams, counselors, and school administrators regarding school policies. Staff should continue or increase communication with caregivers about normal coursework and activities. In certain cases, it may be important to establish more regular tracking of and communication about tardiness, attendance, and academic performance. In situations where staff are able to communicate openly with parents about a student's substance use, staff can follow guidelines similar to those they would use in speaking with the student. Ask the parent what you can do to help and be prepared to listen. Don't make assumptions based on your own parenting or substance use experiences. Avoid moralistic, judging, or shaming statements. And let parents know you are willing to help set realistic expectation for youth coursework, team practices, etc. Finally, let the parents know that It's standard practice to seek help from counselors for any student that you're worried about. Maintaining relationships with youth and their parents, referring them for help, and avoiding judging and shaming behaviors can ensure that the school serves as a protective context for students who are struggling with substance use and their families.